the National Indian Health Board's second of 3 technical assistance office hours for the CDC-RFA-OT20-2004, supporting tribal public health capacity in coronavirus preparedness and response application. Some of you may have attended last week. We did a technical assistance webinar. We did a walkthrough. Some of you may be new. For those of you who did attend last week, we are going to go over a little bit of what we did last week and then have a Q&A. So just to let everyone know that the meeting will be recorded, and the recording will be posted on our COVID response website so other folks can benefit. Again, please keep your phones on mute or keep your computers on mute to minimize any background noise. For asking questions, you can use the chat box anytime or the raise hand feature for questions during the Q&A. And then a post-webinar evaluation survey will be sent after the meeting. If you could please fill that out, that would help us greatly. Thank you. So I'm going to go just quick over the agenda. We'll start with some introductions. We'll do an overview of the funding opportunity. We'll do a quick walkthrough of the application and touch on some of the highlights from the May 14th technical assistance webinar. Some of those questions may be questions that you have. So we'll provide some of those answers of what folks asked last time. And then we'll have an open Q&A after that. So for introductions from the National Indian Health Board, my name is Carrie Joseph. I am the Deputy Director of Public Health Policy and Programs. I will be doing some of the beginning slides and then also monitoring chat box. And we also have Robert Foley. He's our Chief Program Officer. He is our resident expert on all things grant writing and all things grants in our organization. Also on from the Centers for Disease Control and Prevention is Randall Nielsen, Senior Project Officer, and Kate Agin, Project Officer / Public Health Analyst. These folks have joined us this week, and Robert will call upon them if needed to provide clarification or any answers. So welcome to all our speakers. The National Indian Health Board, for those of you who may not be familiar with the National Indian Health Board, we were established by the tribes over 45 years ago to advocate as the united voice of federally recognized American Indian Alaska Native tribes. We seek to reinforce tribal sovereignty, strengthen tribal health systems, secure resources, and build capacity to achieve the highest level of health and well-being for our people. I just want to draw attention to the National Indian Health Board's COVID-19 Tribal Resource Center. This is a new addition to the NIHB website. This is the link up at the top. We have all sorts of information. We have maps of COVID cases, and then by county, where and then also on that map it is noted the population of American Indian Alaska Natives. So that's been very handy for our constituents and tribes who are trying to keep track of COVID cases in their areas. We also have a tab for funding. We have technical assistance. Within that, we have tabs for our advocacy work. We have links to federal agencies and they're responding. We have a community health basically tools. We have probably 18 to 20 different fact sheet one-pagers on different community topics. So I encourage you to visit the Resource Center and see what we have. And the technical assistance information for these webinars are also posted in there. So the materials we have specifically for this specific RFA, we have a fact sheet on the RFA. We have the application walkthrough, basically goes by each section, and it has tips and things to help you when you're writing the grant. We have a refresher on how to write SMART objectives. We have a tips for writing activities and outcomes. And again, the recording, the PDF, and the notes from our last technical assistance webinar are posted there as well. So we hope these materials will be helpful to you all. So the RFA basically is it's what's a little different from usual because it's non-competitive. It's a non-competitive notice of funding, meaning that everyone who is eligible and puts in an application will be funded. It is designed to fund all federally recognized tribes, tribal organizations, consortia, tribal consortia, or their bona fide agents. And the purpose is to support tribal public health emergency preparedness and response related to COVID-19 activities. So on this slide, the funding is kind of grouped into two components, so component A and component B. So component A includes Title I and Title V tribes and tribal organizations, folks who have contracted, compacted funding. And then component B is all federally recognized tribes and tribal organizations. So how it rolls out is the first notice of award will be awarded within 10 days of an application, and the component A tribes will get $25,000 plus additional funds based on their IHS fractionated allotment. Component B will receive a base funding of $25,000. So basically, when an eligible applicant applies within 10 days, $25,000 will be base funding. The Title I and Title V will receive additional funding at that point. The second notice of award will happen in June, and both Component A and Component B will receive a percentage of funds based on the ratio of their population served to all populations served. So in the application, there's a place where you write in, what's the population you serve, the number of folks. So that, depending on how many folks apply and what those numbers are, then that ratio will be calculated. Another thing that's probably a little different about this funding opportunity is that costs incurred for response efforts on or after January 20th, 2020 can be reimbursed by this funding. So a lot of folks had to obviously expend funds to respond to COVID-19, prepare, prevent, treat. So those costs can be reimbursed. And then the other thing to note is that all eligible applicants should apply to be eligible for future funding under this announcement. So we know there's a set amount of funding right now. Should more funding become available, it could be this could be the mechanism by which that is made available. So all tribes, tribal organizations are encouraged to put in an application. So what is funded? There's 8 big areas of work that's funded. Basically, number 1, emergency operations and coordination. 2, health information technology. 3, surveillance and epidemiology. 4, laboratory capacity. 5, communications. 6, countermeasures and mitigation. 7, recovery activities. And 8, other preparedness and response activities related to COVID-19. CDC, listened to tribes and tried to streamline the application and the application process. Applications are funded on a rolling basis, even though the deadline's May 31st. If you applied May 1st, again, within 10 days, you'd receive that first notice of award and that first base funding. So folks are encouraged, to apply early. They've cut down on the number of documents that are needed. There's a very handy checklist. We'll see it in a minute. In addition to the RFA, the checklist can really help you stay organized and see which documents you need to upload. The project narrative basically is a template, is an Excel file template, and that's the work plan, and that serves as the project narrative. So you don't have to do a work plan and a narrative. And then there's only one application for component A and component B tribes. So this is where I'm going to turn over to Robert Foley. Thank you.
Great. Thank you, Carrie. And as Carrie mentioned, my name is Robert Foley. I'm the Chief Program Officer for the National Indian Health Board. And we'll be entertaining as best I can many of the questions and discussions that everybody has today regarding the NOFO and the application process, right? So we're really talking about the content of the NOFO, the process for applying, as well as anything that is proposal specific on your end. Before I start moving into some of the elements, before we open up kind of the question and answer period, I just want to say that NIHB is funded by the CDC. I want to be very, very clear about that. And we have been working with the CDC to provide some technical assistance around this particular funding opportunity announcement. These office hours are part of that. I also want to say that we are holding these office hours and offering this technical assistance from a perspective as if we were going to apply for this fund. NIHB is not eligible to apply, nor are we applying for the fund. So I want to be sure and put that out there and make sure that's very clear. But having read through, and I have my copy all marked up of the application instructions, we're going to be responding to the questions you have as if we were writing it ourselves. And we're trying to give some very real world advice and guidance to tribes and tribal organizations that are submitting actual applications. And that is our hope. We want to have some very frank, honest, concise, and to the point discussion and answers for the questions that people have. But I also want to say that we are just answering from our expertise and our experience. We have no more insider knowledge than anybody else on the line has. That being said, I will say the CDC has been extraordinarily flexible in this process and how they are awarding it. And so I will say that there's far less insider knowledge on this particular funding opportunity announcement than other competitive ones that we're used to. So, with that being said, Carrie mentioned the application requirement checklist. And this is an outstanding tool for people to use. And Carrie, I'm going to share my screen real quick because I would like people to look at the application checklist. So give me 1 second. I thought I had it open, but I guess I do not actually have it open, Carrie, so.
Okay, I just advanced to the next slide. Is that what you're looking for, Robert?
Oh, yeah, I'm sorry. And of course, the minute I did it, I did find it. So these are the elements that are required. And I think this is really important for people to look at and to acknowledge. And this is directly on grants.gov, the application checklist. So you would go to the grant opportunities under related documents. And this is important because if you actually listen to the NOFO, starting on page 20, it begins with standardized language about elements of the application, and it includes elements that are not required. So please look at this application checklist.
Particular partners that we help with this
right. I will say it has this particular checklist includes elements that include online templates in grants.gov, as well as other ones that you need to access through online URLs, and things that are on that you would need to download, sign, and then re-upload. So there's different mechanisms to filling out each one of these. And if you have any questions about those, we can definitely respond to those during the question and answer period. We're not going to go in depth into each one of them. Things that are not required, like a letter of intent not required. Table of contents, don't need to do it. You don't need to do an evaluation of performance management plan. You don't need to talk about funds tracking and monitoring. There's no intergovernmental review, pilot programs, copyright interest, and the data management plan. It should also be said, as Carrie mentioned, that a longer narrative, and actually typed up paragraph by paragraph narrative is also not required. There's only 2 elements required under that narrative part, and it's the work plan, which is the Excel template, and the organizational capacity statement. So, next slide. We had a really, really wonderful, robust discussion on last week's webinar. The webinar went it was scheduled for an hour, it went almost 2.5 hours. So the notes from that, as well as the slides in PDF format, as well as the actual recording, are all on the NIHB Tribal COVID-19 Response Center page. And so you can click on funding opportunities and you'll see the webinar recorded front and center. But if you click on the technical assistance accordion dropdown, you will see a PDF of the notes, which includes all of the questions and answers. And you'll also see a PDF of all of the slides that we presented. We're not going to go through all of the same content that we did last week. So if you want to access that, just know it's all online. And these are some of the questions that we saw. And we wanted to make sure we brought up front. Who is not eligible to apply? There were a lot of questions about eligibility. So state-recognized tribes are not eligible to apply. Native American nonprofits that are not formally affiliated with federally recognized tribes are also not eligible to apply. And urban Indian health organizations and other urban Indian organizations also are not eligible to apply unless they have a formal affiliation with the federally recognized tribe. Right, next slide. I will say, before we talk about allowable costs, it's important to say that eligible entities for application are, of course, federally recognized tribes and tribal consortia. So when tribes come together to form a consortia, whether that be a health consortia or a tribal consortia themselves, they are eligible to apply. And I think that's the easiest way just to boil that eligibility down. There were quite a few questions about allowable costs. And people wanted to know last week if what they were proposing would be permissible under this particular umbrella. So just real quick, legal costs, such as paying attorneys to consult on guidelines or COVID response or jurisdictional issues regarding to COVID response, those are allowable. If you want to seek somebody to help construct telework policies or changing tribal workplaces to allow social distancing, and implementing those kinds of policies and all of the costs associated with that, those are also allowable. If you need to pay rent for new properties to stage any kind of COVID medical supply distribution or additional COVID response activities, that is allowable. Consultants in general are allowable as long as it relates to the COVID response. And modifications to non-federal facilities to support a COVID response are allowable. And I know that somebody wrote into the chat box that they can hear someone else talking. In a time of COVID, I now share my telework space, which is my home. So my partner is also on a national webinar right now presenting. So I do apologize, but that was unavoidable. So I will try and hold the microphone as close to my mouth as possible. Next slide, Carrie.
I think
I did also mention that if the tribe or tribal organization wants to hire a consultant to help create protocols on things such as safely reopening, which is something we're hearing a lot about right now, whether that's reopening the entire community or reopening specific tribal enterprises and creating protocols, for example, on things such as testing, taking temperatures, how to implement social distancing, or other elements of a reopening plan, then that is also an allowable cost, as we understand it and as we would read it. Next slide, Carrie. Non-allowable costs. There were a couple questions where I felt very comfortable telling the participants last week that these were not allowable. I would not advise writing for them. Purchasing land, there was a question, could we purchase land if we wanted to buy land to support, putting some of our COVID response facilities or trailers on? And I have gotten response from the CDC that this was a good answer, that is now not allowed, and you should not purchase land, especially for what is going to be a temporary response. So purchasing land and or buildings is not allowable. And people asked about paying consultants who are helping write either this grant or other grants or supporting in the development efforts. And that is also not an allowable cost under this NOFO and in general under federal funding guidelines. Next slide. So this is an opportunity for you on the line to go ahead and ask questions and put it out there. Feel free to share whatever you'd like to share. If you want to get in depth on what you're writing, then we will respond as best we can and to the best of our knowledge and expertise. As Carrie mentioned, we have two CDC colleagues on the line with us. And should we need to, and should we feel comfortable to, we will ask them to chime in on anything. But I will say in general, we're going to try and answer these questions as a non-federal employee. No offense to my federal friends. So if you do have a question or want to open up, please use the raise hand feature, and Carrie and or I will unmute your line and invite you to speak, and so you'll be able to do that. I do see a question already in the chat box, so I was going to say you could also just use the chat box to enter your question, or you could even use the chat box to say, I have a question, please unmute my line. And Karen Hansen asks, did you say building a facility on property the tribe owns is not acceptable? I would advise against writing for cost of construct a brand new facility, even if it is on tribally owned land. I don't see this NOFO supporting a brand new facility. So Karen, I would, if I were writing for this grant, I would not include that, the cost of building a brand new building. And I'm going to answer this other question in the chat box, Carrie. Margot Wright asks, to avoid the double dipping, can we present our work plan and narrative to say, we will order a new dental chair, or if already funded for the same cost, we will order an OBGYN table. First of all, thank you for seeking to avoid the double dipping. We did talk about that last week. And so I want to talk about that real quick. As there are a number of different COVID response funding streams that are available right now through different federal, state, and private entities as well, it is important that we avoid double dipping, and that's paying for the exact same activity out of two different funding streams. And I'm not going to go into the accounting level on that, but I will say from the programmatic perspective, we all need to be very, very clear on what activity or what part of an activity will be paid for off what grant. And I will say, for example, if you're going to buy a dental chair, then if you're going to pay for that dental chair off two funds, then you need to be prepared to kind of report on 50% of its uses or something to that effect. You really have to account for how much you're going to pay for that chair on that funding stream. Now, Margot, if I were going to be writing this particular grant application, I would actually name one or the other in this application. CDC is being very, very flexible on this. I would write for one or the other. And then indeed, if it so turns out that come June, July, August, you find that you're actually need to purchase an OBGYN table versus a dental chair, then talk to your projects officer or technical monitor. Yep. And see if any kind of change or edit will be required. I will say that the way that they're issuing notice of awards, they are taking the full dollar amount being awarded and putting it into the other budget category to allow for the maximum flexibility. So there might not even be a budget revision required. I can't say, but I would actually, for the sake of clarity, just name one or the other. And then if things change after funding, then work with your project officer on it. That would be my guidance.
So Robert, I can read some of the questions in the chat box if that's helpful. So Amanda Fraser is asking, can you explain the work plan and project narrative requirements? How do we integrate the narrative into the work plan?
Excellent. The term narrative is confusing. So when we talk about a grant application and we say narrative, we're used to sitting down and writing paragraph after paragraph after paragraph under different subheadings. So I want to be clear that that is not required in this grant application. All right, it's called a narrative because that's the element in grants.gov where you're going to upload these two documents, okay? But you are not going to be opening up Microsoft Word and typing out staffing experience. That's not going to be required. All right, there are two elements that will be uploaded under project narrative on grants.gov. It is the work plan. And Carrie, I'm going to share my screen so that I can show the work plan, and hopefully everybody can see this. This is the work plan narrative template. So I would say this is probably where you're going to need to do the most typing, right? And original construction. And you'll see at the bottom of the screen here, hopefully you guys can see my cursor, but this Excel spreadsheet has different tabs, right? The first tab are the instructions, and it provides examples of what you might enter into each one of these boxes, right? You will need to construct the cover sheet, which is just 3 things you need to enter. And then Carrie mentioned that there are 8 topical or specific focus areas for this particular NOFO. It is not required for a tribal organization to create activities in each of the 8 areas. You might, but you don't have to, it's not required. Just look at what your community needs, what you want to write for, and decide if it's under emergency operations, health information technology, surveillance and epidemiology, lab capacity, communication, countermeasures, recovery, and then the 8th is kind of a broader other, right? And then under each one of these tabs, you would write the setting, is it a health clinic, is it a community, the activity description, and my suggestion for the activity description would be to say something as high level as tribe will purchase required PPE to sustain a COVID response through the pandemic period, or something that general. I would keep it high level because the CDC is, maintaining that level of flexibility with their funding. Contributing partners, who you're going to work with, if anybody, key contracts and consultants is this next column, column F. So if you are going to issue a contract like a sub-award or higher level engaged partner, or simply a consultant to help assist with some of those deliverables, enter their names here, and that's all that's being required is their name. The start the date when you're going to start the activity and the end date when it's going to conclude. You, in this work plan, only need to fill out things in the yellow. If there is any box that is white, do not complete it. You only need to enter original text in yellow boxes. And actually, technically, you don't need to enter a new activity number. It's a yellow box, but it's static numbering, so you don't need to. And then that is it. If you're not going to do anything, just leave it blank. Don't delete the tab. Just leave it blank, skip over it. If you're going to do something in surveillance and EPI, for example, start writing your activities here, same elements, so on and so forth. And then once that is completed, that is your work plan. That is 50% of what's going to be uploaded as your narrative. And so there is no need to incorporate this document into anything else other than necessarily your budget, because you obviously need to construct a budget based upon what you're writing in your work plan. The other element of the work plan, so Carrie, I'm going to go back. Actually, we can leave that up for a little bit. It doesn't make much of a difference. But I can no longer see the chat box, Carrie, so I'll rely upon you.
Okay.
The other element of the narrative is the organizational capacity statement. There isn't a template for this, and the CDC has provided some examples of what would suffice for an organizational capacity statement. And I personally think the easiest thing to do would be to write a letter on official tribal letterhead, make sure it's signed by an authorizing official within your tribal system or within your tribe or tribal organization that describes the tribe's commitment to completing the work plan, the tribe's ability to complete that in the given amount of time, and the tribe's capacity insofar as the resources, the facilities, the space, and the staffing to complete those things. I personally think that that is the easiest element. You can also upload, if you have an org chart for the tribe or tribal organization, especially an org chart that delineates the department or the team that will be implementing the response or implementing the activities of the work plan. We've been told that that will also suffice as an organizational capacity statement. Those are the only two things that comprise that narrative and need to be uploaded. You don't even need to PDF this Excel. We heard right from the CDC that the Excel document itself could just be uploaded as an Excel document in grants.gov. So I see our partner at CDC would like to comment on that. So Kate.
Hey, thank you, Robert. Hi, everyone. I'm Kate Agan. I am a project officer working with the Tribal Cooperative Agreement and now this new tribal grant. And Robert, very, very well articulated with this work plan, and thank you for pulling it out for everyone. Also on the CDC website, we created some a guidance document to help walk you through this. So you can reference that as well. And that is on cdc.gov/tribal. And then you can, there's a box there that says learn more about funding opportunities for tribes, and click that and follow it to there. And it's a PDF file, so it's very easy to follow. And for the PDF versus Excel, with this Excel document having so many tabs, it does not convert well to PDF, and it actually is a lot easier for you all to keep track of your work plan and then do your progress reporting and then send that to us as an Excel file, and it's easier for us to look at it and pull the data from that versus a PDF. So thank you for that, and I'll stop there.
Okay. Hey, will you take that URL that you mentioned and put that into the chat box for everybody?
Yes, I'll do that right now.
So Robert, I'll read another question. And for everyone on the line, I did give you the option to be able to unmute yourself. So if I read a question and you need more clarification, please chime in. So the next question is from Nicole Barallo. What about water system repairs so that homes can receive safe water?
First of all, I want to say we know that this is a huge issue in Indian country, and it's something we've been elevating. So I will just say this at a very high level. We know hand washing is an important element of the COVID response, and it's something that's been promoted by every single global public health agency. So if the attempt is to bring safe water to homes so that they can engage in hand washing or other disinfecting activities, then I would say that this is an allowable and justifiable expense, and I would write for it.
Okay, next question from Anis Smouse, and I'm sorry if I'm mispronouncing people's names. What if the tribe does not have a lab for testing, etc.? Would it be wiser to ask for funds for a mobile lab for testing elders in the community rather than requesting funds for a standing lab?
If I were going to tackle lab capacity, and we also do know that, you know, the majority of the tribes in the country don't have their own standing lab, more than a majority of the tribes don't have their own labs. And if they do, the lab may not be equipped to process the COVID tests, the variety of COVID tests that are out there. My advice would be, if you are seeking to create additional laboratory capacity, and here are some of the things that CDC has put in their work plan template, and hopefully everyone can still see my screen up at the top under strategy description. Activities may include, but not limited to, procurement of equipment, supplies, shipping, staffing, associated with testing and other lab activities. They don't specifically talk about constructing a lab. My advice would be to not write to construct a new lab. If the tribe has a lab and they just need to bring their lab up to a certain level or purchase new equipment that would allow them to process COVID tests, I think that that would be allowable, absolutely. If the tribe already has a lab and they just want to create a mobile element for testing, I could see how that also could be entertained. But if the tribe has basically zero lab capacity at this point, my guidance would be not to write for constructing a new lab or building a new lab or introducing lab capacity from the ground up. I could just see, and again, I'm predicting the future. I have no inside knowledge, but I could just see that might raise a flag here or there. So if you don't already have a lab, I would not advise on writing to build a lab or construct a brand new mobile system if you don't already have a lab in place. That would be my advice.
Okay, next question from Ann Wyatt. Can we use this grant to consult with legal counsel to make sure we're using CARE Act relief funds the right way?
Yes. I feel very confident to say absolutely. Yep.
Okay, we have a question from Linda Santee. I'm gonna unmute you. Go ahead, Linda.
Thank you. On the 3 ways to do capacity, one that we haven't talked about a lot is the incident command. And I have, at the Winnebago Comprehensive Healthcare System, there's 2 divisions, Winnebago Public Health Department and 12 Clans Unity Hospital. In my hands is the 12 Clan Unity Hospital Incident Command Structure, which is a contact list, and it's divided by the areas. So, you know, in the planning section, there's these people, and this is their titles. And but it's not in a hierarchical structure.
Like an organizational chart kind of structure, like a very pyramidal.
Correct.
Kind of structure.
Correct.
Yeah. Huh?
But it begins with, you know, here's the incident commander and liaison, public PIO, et cetera. And then it goes to the planning section, and here's the people in there and their titles. Logistics section and their titles, including housekeeping and the whole. I mean, it's a robust, in my opinion, incident command. And I was thinking of that rather than the letter from our ED. That's one question. Do you think that that will suffice? And the second question is, I only have it right now. I'm trying to track down one for our public health department, but right now I only have a 12 clans one. So does that mean I could only ask for 12 clans things if that's all I can manage to cough up here?
I absolutely understand. And I'm glad you asked the second question. So I'm going to answer your first one. Linda, it's great to hear your voice. I know we've been emailing a little bit.
Thank you.
I think what you had, the incident command kind of protocol and structure that you have, is a wonderful document that speaks to organizational, in this case, tribal capacity. So I would not reinvent the wheel. I mean, in all honesty, if you have a tribe that has an incident command already in place and a plan to put that in place, what more do you need around organizational capacity than, hey, guess what we are doing, what we've set up? That's exactly what this funding is here to support. So I would not reinvent the wheel. Now, this is what I would say. If you can, in some way, shape, or form, even if it's just even a one-page letter that you can also acquire, because you can add more attachments under that narrative element if you want to, saying that the incident command structure that you have and that you have uploaded as your organizational capacity statement serves the entire population that the work plan will reach, so that you're actually kind of linking the two, since what I'm hearing you say is that the incident command is for this element, 12 clans, and not necessarily the public health department. So if you can just create like one more letter, just a short little paragraph that's saying 12 plants is supporting the entire response activities for the entire tribe, and even surrounding tribal members, then I think that would link your work plan and your organizational capacity.
And
Does that make sense, Linda?
yeah, it does. Thank you, Robert. And conversely, if I can track down the equivalent, which frankly I think exists, I just am not able to get it, for the public health department, then I can upload both.
Yeah, yeah.
Okay, thank you.
Mm-hmm.
I don't see any other questions in the chat box. So if anyone has a question and wants to unmute themselves and ask it verbally, please do. Or if you're not able to unmute yourself, just chat in the box and I'll unmute you.
I do see a chat box question from Nicole, and Nicole, hope I'm pronouncing you correctly. Said, sorry, you said 2 documents to upload on the project narrative. One's the work plan, and what was the other? The other is broadly referred to as an organizational capacity statement, and that's what we were just talking about, Linda, on the line. That can be, there were 3 examples CDC provided. It can be a letter from tribal leadership or health leadership or organizational leadership, attesting to the capacity of the tribe or the organization to stand up a COVID response and or do the activities within the work plan. It can also be an organizational chart for the staff, departments, the elements of the tribe that will be responsible for delivering the work plan activities. And it can also be a copy of an incident command plan, incident command or emergency response structure, things of that nature that really speaks to facility staffing, resources, et cetera, that can be dedicated to a COVID response. So those are the 2, right? The work plan and the organizational capacity. Together, you upload those as separate documents in grants.gov under the narrative. Kate did put up the link in the chat box. There's a link to the work plan template guidance, right? So that is a CDC.gov document that you need to access and use that Excel document there. And then she also put up the website that they've created for this particular NOCO that has the resources that she referred to. So thank you, Kate, for doing that.
Robert, I don't think I can see the chat box now. However, we're doing the screen sharing.
Okay, thanks for letting me know, Terry. I will say Zoom is a new landscape for many of us, so I know we're navigating as best we can. I can see the chat box, Carrie, okay. So I'll be sure to catch anything that comes in.
Well, I did catch I see the one from Amanda Frazier. Do you see that one?
I do. It says we plan to purchase the COVID-19 kiosk for temperature, et cetera. There's recurring costs to have that software for a second year, and I include this cost. I would say at this point in the budget, I would only write for 1 year's expenses for the rental of the kiosk, and that's what I would write for in the budget, is just a single year to rent the kiosk and have it housed. And then I'm just going to be blunt, and this is not coming from CDC or any other official person, but nobody knows what's going to happen with COVID, come August, come December, come 2021. And so if there are funds left over, then there will probably be opportunities for carryover requests and utilizing any funds for future response. And there might even be additional funds. Who knows what the state of the pandemic is going to be in 10, 11, 12 months. But if I were budgeting for it, I would just budget for 1 year for the software. You're welcome, Amanda.
Any other questions?
While people are thinking of perhaps flipping through the pages of their notebook, I believe I'm still sharing my screen, and it's back up on that question slide, and that does have my email address. So please feel free to email me directly if you have any questions. I will do my best to get an answer for you. And I would say I've probably gotten about 10 or so questions over the last week. So feel free to shoot an email if you have a question in the coming week, or if there's an email you don't feel comfortable sharing or asking right now, please feel free to use that. And that resource and that assistance will be available all the way up through May 31st. But I will say, I will not be sitting at my computer come May 31st all the way through midnight Eastern time, waiting for those last minute questions. So try and ask them now.
Nor will I.
Right. I do want to say, just, and I've said it, I think, 3 times at this point. Jeffrey's asking about the public health system impact statement. You do not have to complete an impact statement for this grant application. Some things that I want to reiterate, and we did hear this from CDC on the webinar that they hosted, the pre-application webinar, on the 3rd one, I believe. There is a $25,000 floor, and that is a guarantee funding for every eligible applicant. And there's a $1.5 million ceiling. However, we heard from CDC, and we've said it a couple times ourselves, that you should write for your anticipated need, even if that is above the 1.5 million, because there's an opportunity should future funds become available, or, well, I'll just say should future funds become available, that those who applied and asked for more and were funded at a lesser amount, that this funding stream could be used to supplement any existing awards. Now, some people did ask, somebody asked, sent me an email and asked about writing for, around $6-7 million. And I said, I would not advise for that, just on a grantsmanship level, knowing there's 159 million total sitting in this NOFO pool that's going to be disseminated amongst tribes. Applying for $6 million, I just think is an unrealistic percentage of the total amount. And so rather than write for something that you absolutely know is not going to get funded, then take out the elements of that is the most important to the tribe, the need, the community's need, and the community's response, and write for that. If it goes above 1.5 million, that's fine, but there's a certain point, I think, where you have to ask yourself, is this practical for me to put all this work in to justify and write a budget for 4 times the ceiling amount? And from a grant writing perspective, I don't think it is, so I would advise against going too far above that ceiling. And Nicole said there's no limit to apply for, and I think that's kind of what I just spoke about. There is a published ceiling of 1.5 million, but we've also heard from CDC to apply for your actual needs. So I think that's wonderful. Apply for your actual needs. If you do apply for more than 1.5 million, be prepared for the CDC to come back to you and say, we're going to fund you with this amount, and we're going to need a new budget and a new work plan to reflect that lesser amount. and you're very welcome. Again, I hope your name is Nicole, if I'm pronouncing that correctly. You know, I will say I'm more than happy to sit here for a while, even if that is silent, if people need time to collect their thoughts or flip through their notes. But we are coming up on the hour, and I would say if we don't have any more questions come in, Carrie, Kate, and Randall within the next 5 minutes, then I would feel comfortable enough to sign off at the top of the hour. And know that people can email myself, Carrie, or anybody at NIHB really to ask any further questions. And Carrie, before people do start signing off, I don't have the information right in front of me, but do you have the information on our second set of office hours that we're holding next Tuesday? And Kate has published the email address the CD has created for this particular NOFO. That's tribalcovidnofo@cdc.gov. That's also a good place for any questions that you may have. Harry, you're on mute.
Okay. So the next virtual office hours, as Robert said, are on Tuesday. Let me check the exact time.
I think it's the same time frame.
I think it is too, but I'm gonna double check. Why is this? Hang on. No, I'm having trouble here.
I can click through real quick. Hopefully not everyone's looking at my Outlook calendar right now, but it is 3 to 4:30 p.m. Eastern time next Tuesday,
we are looking
May
at your calendar.
26th. Well, then everybody here is a complete calendar invite. Really, there's nothing here that you can't access yourself. There will be another Zoom meeting, and the registration information has also been published, and we have it. And we will be sending out another announcement, I believe, right, Carrie, to register for the office hours.
Yes, we'll send something out. Well, we'll have to send it early on Tuesday.
Yeah. So feel free to pop back in. It'll be a format very similar to this, with just spending most of that 90-minute answering questions, having discussion, as best we can to help tribes receive these funds, and help the CDC get these funds out to the tribes. Really, that's the ultimate goal. So with that, here are the links to the funding opportunity announcement on grants.gov, although I imagine most people have accessed this at this point. Here is the link to NIHB's funding opportunities that have the technical assistance materials we've created for this particular NOFO. If you have some general COVID response questions or concerns, Courtney Wheeler is serving as our point person in general for our response, and feel free to email her. And then again, there's my email if you have questions on this particular notice of funding opportunity. We'll go ahead and stay on for a couple of minutes longer. Well, it is the top of the hour, and I haven't seen anything new come through. Okay, so with that, thank you everybody for signing on, but most importantly, thank you for the work that you're doing for your tribes and your tribal communities, and supporting all of these efforts and systems to mount a valid, viable, reliable COVID response locally. So, thank you very much. Good luck in all of the application writing, and let us know how we can help you. Thank you.
Thanks, everyone.